Right, good afternoon, everyone. I'll start now. I apologise in advance. If you've seen me on the webinars before, I always lose my voice. So I already can sense it's going to happen again today. I hope you can all hear me okay. If you can't at any point, just let me know. Today's session, I will share my screen. Today's session is on preparing for the UCAT. So this is just an overview of what you need to know before sitting a UCAT, before starting your revision, all of this sort of thing. If at any point you've got any questions, please feel free to put them in the Q&A box. You can put them in the chat as well, and I'll try not to miss them. But this session is a little bit more interactive than some of the others, so we might be using the chat for that. So I don't want anyone's questions to get missed. If you put it in the Q&A box, I absolutely won't miss them. I will come to questions at the end if that's okay with people. If there's any, urgent questions like, oh, why can't I hear or see what's going on, I will obviously answer them as we go. But in terms of actual, questions about the UCAT or medical school, or what it's like being a medical student, I'll just answer them all at the end because it's easier to keep track of for me, if that's okay with you. Okay, so yeah, preparing for the UCAT. So my name's Ella, I'm one of the 6 med tutors. I'm also just about finishing my 4th year now of medical school. Got 1 more exam to sit and 1 more week of placement to do, and then I will hopefully be through to 5th year, which is my final year. I study at University of Manchester, but I'm based at a hospital just north of Manchester, because at Manchester we do most of our teaching in our base hospitals. So it has been a while for me since I sat UCAT. It was called UCAT back in the day, so I also apologise for if I misname it. It's a sort of a force of habit. But it was the same exam, it just had branded as a different name. Yeah, any questions as we go through, just pop them in the chat. So you guys should know what 6 med is. I'm not gonna harp on about it too much. So what are we going to talk about today? Give you a bit of an introduction to the UCAT, go through what you need to know about applying for the UCAT, the actual sort of process of taking it. We'll talk a bit about the questions that come up in the UCAT and how to answer them, some top tips, and then at the end we'll do the Q&A. This is a webinar, so you have to stay muted. There's no option not to be, but please type answers in the chat box. That's absolutely fine. And yeah, feel free to ask any questions. So just to start off with, you can put it in the chat if you want, you don't have to, but just think to yourself, on a scale of 1 to 4, how confident are you for revising for the UCAT? I remember when I first applied, I was terrified of the UCAT. You've never really sat an exam like it before. Some of the questions are a little strange, and so it is quite scary. Someone's at 0. Most of you are sort of 1 or 2, which I think is about where I was back when I was at your stage. But it's not too hard of an exam. It's what you revise properly and know what you're in for, you should have at least some confidence, and I'll give you some tips as we go. If any of you have already sat the UCAT in a previous year and not done so well, or you've started revision and you're struggling about specific areas, feel free to ask. I'll try and do my best to help. So the aims of today, we want to understand what the UCAT is and learn how to approach the questions. So what exactly is the UCAT? Well, it stands for University Clinical Aptitude Test. And it's an admissions test that's used by most of the universities in the UK for medicine and dentistry. Obviously, the other admissions test for undergrad is BMAT, which some of you will have heard of. And I'm not going to go into anything about BMAT today, but if the university isn't a BMAT university, it's probably a UCAT one. It's computer-based and it's multiple choice questions, which is quite nice that it's multiple choice questions. The fact that it's computer-based, you need to practice using a computer. Some of you, I'm sure, are pro gamers and use a computer. Well, I mean, you guys are actually a bit younger than me, so maybe you've completely grown up using computers. But I was not so computer savvy when I was applying. So if you're not, maybe, have some practice, even just learning how to type quickly, things like that. You book a test through Pearson VUE. Test centres usually take it in the same place you take your driving theory test. And if you're applying for 2023 entry or deferred 2024 entry, you sit the UCAT between August and October 2022. It's always usually August to October of the year. You usually take it just before you send your UCAS application in. That's all it's saying, but you have to sit it the summer just before you apply. So just important aspects of the UCAT that you need to know. So there is a fee to sit the exam at £70 every time you sit it. BMAT, I think, is also a paid exam, but sometimes schools will pay for the BMAT. You only have one attempt per academic cycle. I get that asked this so much. You can only take it once a year. You're allowed to take it as many years as you want, but just once every year. So if you flop and you think I can't apply this year, then you'll have to wait a whole another year to apply. You get your results immediately. You walk out the room and they print off a piece of paper, and it's got all your results breakdown on it. And universities use the scores differently to allocate interviews and offers. Different universities care about different aspects of your application differently. Some really care about UCAT, some think it's a bit daft and won't look at it as much. Some will use it as a cut-off system where they'll say over a certain amount of points, we'll take them to interview. Others use it more contextually where they will consider the UCAT score, but they'll look at your whole application, and maybe if you didn't do so well in the UCAT but you did better in your GCSEs, for example, and you've got really fabulous work experience, then they might also ask those individuals to interview as well. I know Manchester does that, where they specifically look and say, oh, this individual's from like a school where not many people go into medicine, or they come from a slightly more deprived area. So even though they got a lower score, we will still take them to interview and give them a shot. So if you're trying to figure out which universities do which, they should all be very clear on their website what exactly their process is. If you're struggling to find it, you're absolutely within your right to email the admissions teams, and they should tell you what they do, basically. So these are the universities that currently require the UCAT. I'm not sure if it's all of them. I personally didn't make these slides. I just want to say one of the other tutors made them, which they're fabulous slides, but I can't, take credit. But these are the universities that use them. If you go on university application pages, they'll tell you which admissions tests they require, so just double check them. So the sections within the UCAT, there's 5 sections, although it's kind of sometimes considered as 4 sections plus situational judgment because it is slightly separate. So verbal reasoning is the one that comes first and is considered by many people to be one of the hardest. It's really a comprehension, but it's lots of comprehensions within a very short space of time, and it just asks you to evaluate written information and get some MCQs on it. You get 21 minutes for that section, so you get about 28 seconds per question, which is a really short time, especially for verbal reasoning, because you have to read the paragraphs as well within that time. Decision making is a newer addition to the UCAT. It was introduced around the time that I sat my UCAT back in the day, so it didn't used to be a thing. And it's really testing your logic. I used to quite like decision-making questions. I didn't think they were that bad. And it just tests your ability to make a good decision, really. 29 questions, and you get 31 minutes to do this section. It's definitely the least time pressured section. So you get over a minute on each question. So quantitative reasoning is a maths section. It really is just simple maths, and it just evaluates your ability to do the simple maths. That's really it. Again, very time pressured, which is the issue for many people. Abstract reasoning is another dreaded one. I would say verbal reasoning and abstract reasoning are the two that people struggle with most. It's used to sort of assess how good you are at picking up patterns, and this one is very, very time pressured. I understand for you guys it's stressful. I will try and explain, some tips for it, but realistically, it's one of those ones where you have to learn how to trust your gut and pick up patterns quickly. So it's a tricky one. Situational judgment is another sort of nicer one, I guess. You're given real world scenarios and you're asked to make an ethical decision on them. Usually it goes along the lines of gives you a situation and says how appropriate was the actions that were undertaken in this, and then you have to say how accurate. 69 questions, 26 minutes, so 23 seconds a question, and that was marked slightly differently. So here you go, scoring. So each section is scored between 300 and 900. Okay, someone's raised their hand. Did you put a question in? If you just put your question in the chat, I'll keep it out in the chat. And okay, so whoever raised their hand, just put your question in the chat and I'll keep the chat open and try and pay attention to it as I keep talking. So scoring works, so each section is scored between 300 and 900, and then your marks can be combined for overall scores. And you might also see average scores being used, where you just obviously divide it by 4 and find your average score. And those first 4 sections that we talked about, so all of them except for situational judgment, are marked in this way. And so when people talk about their numbers, their UCAT numbers, that's what they're talking about. SJT is expressed as bands, so you get between band 1 and band 4, band 1 being the highest, then band 2, then band 3, and then band 4 is the lowest. And usually universities don't look at the SJT as much, but sometimes they will automatically strike students who got band 4. So average scores in 2021, verbal reasoning was, as you can see, lower than the others. It is really hard. Everyone finds it hard, which is a sort of reassuring, because you just sort of want to get higher than the average, don't you? You don't necessarily need to get 100% of everything, but it was slightly lower than the other sections. Maths, obviously, people do better in. A lot of people are going to sit A-level maths who want to do medicine, so tend to be good mathematicians, so that's a slightly higher score. And band 2 is just the most common band to get in situational judgment. So this is the timeline of your UCAT and applying to medical school. I don't know how much you need me to just read this out to you, but you can book in June, and then testing starts through summer and ends by October. Well, it obviously ends by October because that's when the UCAS deadline is. The UCAS deadline for medicine is earlier than other courses, so please don't get caught out. I know people who have. You need to apply by early entry deadline. And then you'll get your results, your interviews, and then your results. And then hopefully your university place. So section 1 is verbal reasoning, which is this comprehension section. 44 questions in 21 minutes, as I've said. You're given a passage and then asked questions on the passage. So there is usually multiple questions per passage. And the questions can either come in these two forms, that they on the bottom of the screen, which are most suitable questions, and then true, false, can't tell questions. So I'm trying to see, I apologize, I'm trying to see if they had an example of both. I think they do. So most suitable questions is which of these answers fits what the passage says most. And then the true, false, can't tell questions are basically just saying, is the statement true, false, or from the passage, can't you tell? And that's pretty self-explanatory. I think you should have all done similar questions to those before in your schooling careers. So the trickiest part is, you'll see here, the passages are really long, so you have to get good at speed reading. That's the number one thing that will help you improve your score in these types of questions, because it's just that the passages are so long that it just takes up most of your time. I will give you a minute to just read through the passage and then think about what your answer would be. I think most of you will have just seen what the answer was because I had to flick through the slides quickly. But just see if you can understand where that answer has come from. I'll just give you 30 seconds. Okay, hopefully you've all had a chance to read that passage and read what the question said. The answer is false, because nowhere in the passage does it explicitly say that the students must undertake an internship to be offered a full-time job. This is usually where people get tripped up a little bit, because there's implications, or it'll say something along the lines of students who undertake these internships often get offered a full-time job or something. So a lot of people will choose true because they've read through it quickly and they've sort of missed that there hasn't been an explicit point that agrees with the statement in the question. I hope everyone understood that one. I think it was pretty self-explanatory. So tips for verbal reasoning: read the question first and then search for your answer. It's up to you which way round you find it easier. I would usually skim through the passage first, then read the question, and then go back and specifically search for the answer. Don't try and remember it just because of that being explicit. You might in your mind remember that it was, when actually it was more nuanced. Practice reading things quickly, and just even if you're practicing general comprehension style questions, you should be okay. I always see people asking about question banks and things for UCAT. It doesn't actually matter early on if you are using just a comprehension style question for verbal reasoning, even if it's not a UCAT one. The technique is still the same, and you can build up your technique and your speed, and then nearer your exam use real UCAT banks of questions, so that you can actually test what being in the UCAT would be like and whether you can actually accurately answer the questions. But it's absolutely fine to not use a UCAT verbal reasoning test while you're first trying to get your technique down. So don't overthink or hesitate. If you're really stuck, choose an answer. You're allowed to flag, there's a little flag at the top of the screen, which will mark the specific question. So just choose an answer, flag it and move on. And if you have time at the end, you can then come back. But yeah, try not to overthink. If you start overthinking, then you'll be stuck on a question for a long time, and your gut instinct in the UCAT is really important, and a lot of times it is actually right. And learn to scan effectively. Again, even if you're just reading books and just practicing that technique, that's great. Okay, someone raised their hand again, but I think if you raise your hand, just make sure you put your message in the chat, because I can't unmute you. Okay, sorry, go. And then, yeah, flag, move on and come back later. Okay, so that's the end of verbal reasoning. I hope it's pretty self-explanatory. Verbal reasoning is hard, but they're skills that you have, been practicing since you were in primary school. So it should be self-explanatory in terms of okay, someone raised a hand about the previous question. I'll still go through it at the end if that's okay. The actual technique is something that you've been practicing for a long time, so it shouldn't be that you can't understand why the actual technique shouldn't be that difficult for you to understand, whereas some of the other questions are a little bit more abstract. But it's just speed really with verbal reasoning that trips people up, and knowing when they're being explicit. So decision making is the next section, 29 questions, 31 minutes, we've already said. Sometimes it's set up similar to the verbal reasoning, where you're given a passage and then ask questions on it. And sometimes they give you data, which are usually like bar charts or pie charts. Drag and drop questions are where you have to pair up two statements together. So they will give you a passage, for example, and then give you a list of statements and then another list of statements, and you have to, connect which two statements fit together. And then the others are just asking you to draw conclusions based on texts given. So this is an example question. This is a very typical example question from decision making. So all my jumpers are blue, some of your jumpers are red, but none are yellow. The jumper is either yours or mine. So answer yes to find conclusions. No, it doesn't. Okay, I didn't make this question. So some of your jumpers are red, none are yellow. The jumpers are yours. Okay, I'm not really sure what this question is saying. I didn't choose this one, sorry. But this question passage is very, very typical for these decision-making questions. So they will usually, they're like those riddles. So they'll say like, a magpie is a bird, but all birds aren't magpies. They always go along those kind of lines, and then they'll ask you questions on it. So let's take C, the question C. So if the jumper is mine, it's blue. We know that that is a true statement because all of my jumpers are blue. But if it said, if the jumper is blue, it must be mine. That's not technically true because there can be jumpers outside the question, if you understand what I mean. It's really just sort of trying to show you the layout of a decision-making question. It's just logic and trying to draw conclusions from the information they give you. So again, it's kind of similar to verbal reasoning, but you're not exactly looking for the answer from the text. You have to sort of do a little bit more thinking to draw the conclusion yourself and then apply the conclusion to the question. The questions with decision-making are not that tricky usually. It's just that they take you a little bit more time because you have to read and then process the information before you can answer a question. You should be given a whiteboard where you can write down key information. If that helps you, then feel free to do that. Some of you will be naturally logical thinkers and you won't need to, that's also fine. Don't skim over the information in decision making. The passages are generally short and you have to sit there and think through what exactly they're saying. So give yourself the time to understand what the information says before you actually go and answer the questions. The questions in decision making, like they are like laid out like this, where you have 5 statements related to the passage. And once you've figured out what the passage is saying, usually the statements are quite easy to figure out what they mean. So give yourself the time on the actual passage and then, whiz through the questions, because that should be fine. Again, practice, especially if you're not a logical thinker, then you obviously need to practice a little bit more, just so that you can learn how to pick up the information, because unless you're someone who does like riddles, this might not be a technique that you've used much before. So yeah, just practice and you should be able to pick it up quite easily. And obviously you can flag the questions again. There will be less decision-making questions on the internet, but just because it is one of the newer sections. I can't remember what it replaced, but it's only been 5 or 6 years that it's been in place, so there are less questions on the internet about it. Quantitative reasoning is like most people's favorite, as I mentioned before, because it's maths problems. 36 questions, 24 minutes. Just general tips for quantitative reasoning. Practice your mental maths beforehand. It's much easier than using a calculator because you should know it like that. The calculator that you have to use in your UCAT is one on the computer screen. You're not allowed to bring an external calculator in. So you have to type with your keypad onto this calculator. So it does take time to pull up the calculator, type it in and check. So if you've got good mental maths or good written maths, even if you're doing it on a whiteboard, that is much quicker than using the calculator. But then again, if you're stuck, you can obviously use the calculator. I just wouldn't check answers that you should be able to do mentally. And again, practice, avoid thinking about questions you flagged before. Yeah, so don't get stuck up on a question that you've already flagged thinking, oh, what was the answer to that? Don't get distracted. Just, like with all things in medicine, like your interviews, etc. If you mess up on something, you just move on and tackle the next question. You're trying to rack up as many points as you can. So it doesn't matter if you lose a point, but you don't want it then to affect your performance going forward. The other thing is, don't worry if you're not doing A-level maths. I didn't, and I did really well in my quantitative reasoning. I'm not good at maths. It's something that I actually dread, and I still got 890, I think, in my quantitative reasoning, which is a very high score. It's simple maths. They aren't asking you to differentiate. They aren't asking you to do any strange equations. It's usually addition, subtraction, multiplication, and division. She hasn't given an example of this question because they are just basic maths questions. So it'll be along the lines of asking you to add and subtract. So I'm trying to think of an example question. Something, they are usually written in as a word problem. So it would say something like, if I had a piece of wood that was this length and I needed 3 pieces of wood of this length, how much wood would I have left over, sort of kind of questions. And yeah, they're relatively easy. They're not something to worry about. Still practice them, obviously, but for most of you, you should cope quite well with quantitative reasoning. Abstract reasoning is a tricky one. 55 questions in 14 minutes, which is a very little amount of time. You're asked to identify patterns within 2 sets of shapes, and you'll either be asked, you'll be given some shapes and you'll be asked whether they fit in set A or set B, or you will be told this shape belongs in set A will be, and you have to sort of pick up on what the sequence is. So for example, if set A, the top shape in the top left-hand corner, if we take that and then the next shape next to it, the circle and square had moved round clockwise, the sequence would be that they're moving around clockwise, and you have to pick up that that's the sequence. It's usually how the questions are laid out. Abstract reasoning is really difficult because the patterns are often really hard to spot. They tend to be very obscure. And even sometimes when you practice and get the answer right, thinking you know what the pattern is, you'll read question banks usually tell you what the pattern is. You'll read that and you'll think, oh, that's not what I thought it was. So it's something where you do so many of them that you have to kind of pick up a gut feeling. Very few people I know were actually able to identify the patterns in their actual exam. It takes so long to identify a pattern in these shapes, and you really don't have long at all. And so yeah, it's largely gut instinct. So out of all of the question types, this is the one that more than anything you need to practice, just so you can get a feel of what kind of things can be asked. There are lists that people have made of common pattern types that come up. So it might say things like, look at the stripes, look at the colors of the shapes, look at the places. And I remember before my exam trying to learn those and thinking, when I go into my exam, I'll run through this list and try and see if I can identify that the pattern's one of those. And if not, then I'll just have to guess. You just don't have time to do it in the exam. It's either you see it immediately or you get a gut feeling. So I wouldn't get hung up on doing anything like that. I would just more practice the actual questions. I feel bad, giving that advice, because I'm sure some of you will be like, no, give me a technique to attack abstract reasoning. It's so hard because there isn't one that really works in such a short time limit. So I apologize, but the more you practice, the more you'll pick up how to do it, and you should be okay. And again, people score quite low on this generally, so if you don't do as well, hopefully you're still in the around the average or above it. So situational judgment test, this one's quite easy to revise for. It's probably the only one out of all of them that you can actually do a little bit of revision if you do want to, that isn't just practice questions. 26 minutes, 69 questions, and it gives you situations and asks what you would do. So either asking you to choose the most important answer or the most appropriate answer. So it will give you a scenario, then it will give you a question and say, well, how appropriate was this? Very appropriate, appropriate but not ideal, inappropriate but not awful, and then very inappropriate, and you have to choose which one it is. So yeah, there's an example question. Brilliant. Again, the passages are quite long, so you need to skim read. It usually is okay to skim read in situational judgment questions because they're not actually asking you to pick up on individual details. Things that you should have read through before taking your UCAT would be things like professionalism. So the GMC, which is the big medical council, and I'm trying to think who else, BMJ might have some information on it. Look at what they say about professionalism in medical school and as a doctor. You should know general rules like, is it appropriate for a doctor to have pink hair? The answer is that actually you're not allowed to, you're not meant to wear makeup, things like this. Just be aware of rules like that, just common professionalism issues that might come up, things like drinking on the job, obviously not appropriate. And if something comes up that you're not sure about, that you've never read about before, then all you have to think of is the patient in the situation in danger? Is a healthcare professional being undermined? usually it's those two. Is another colleague in danger? And sort of what's the impact of the situation on the public's perception of healthcare professionals? If any of those are being undermined or negatively affected, then the answer is almost always very inappropriate. If there's no, if things like that have all been sorted by the answer, then the answer is usually very appropriate. I know a lot of people attempted in these, let me just get this up so you can see what the answers look like. A lot of people, when they do these questions, are very drawn to choose the two middle options because they think, in real life, that's what we would do. We would say, oh, it's appropriate, but X, Y, or Z would be more appropriate. Don't sit on the fence too much. If you do think it's very appropriate or very inappropriate, don't be scared to choose those options because quite commonly it is those. But it's just don't sit on the fence because I know people are drawn to choose those two middle options, but just try not to. I'll give you a minute to just read through this question and the answers to see what you think the answer might be. Okay, I think most of you will have read through it. Okay, the answer, she didn't put the answer on. The answer is very inappropriate. I've seen some of you put it on. The answer will be very inappropriate. It's a real life thing that happens all the time. I was asked at the beginning of my 4th year by a psychiatric patient if I smoked marijuana ever. It's obviously a very inappropriate thing to ask and would be a difficult question to answer because no matter what you answer, you actually run the risk of damaging that relationship with the patient. Doctors shouldn't really be doing drugs. And so whether you do or not do them, then you don't want to tell them, you want to say that you don't, but also you run the risk of speaking to a psychiatric patient who is potentially violent, who might smoke marijuana themselves. Saying no can come across judgmental and that you're better than them. So you never should really speak openly about your life and shouldn't give away personal information. In all those situations, you're actually meant to say, we're not here to talk about me, we're talking about you now. So if you said very inappropriate, brilliant. I hope everyone understands why that's very inappropriate. The most difficult thing with SJT questions are if you were saying they're having a debate about them, you could say, but it's appropriate because of, it would help build the patient's rapport. They might think, you're hiding something, if whatever, but you just have to break it down to, the bare bones of the actual ethical principles and just choose your answer based off that. But yeah, but it's very inappropriate. This is how the questions usually are just laid out. Most people don't struggle too much with them. But again, the more you practice, they do keep, the same questions will repeat themselves. So again, just practice and get used to learning what's appropriate and not. SJT, by the way, we take another SJT exam at the end of your 5th year, and it plays a very big part into where you end up studying for your foundation year program. So that's why SJT is important. So just the general top tips for all the questions. Practice under time conditions. I would say like a caveat to that is if you've not done any practice for UCAT before, it's okay to go through questions slowly and actually just practice the technique. You know, even if you're taking 5 minutes to do a question, that is okay. Learn how to do the questions first, then get quicker, and then make yourself take mock exams under time conditions. If you are trying to learn how to do it under a time condition to start with, then it's incredibly difficult. It's a lot of pressure, and you'll just find yourself being unmotivated because you'll be like, oh, I'm doing rubbish, you know. So I would say practice under time conditions as you're coming up to your exam. It's okay to, you know, practice not under time conditions earlier on. Flag, move on, return later. Like I said earlier, big thing in medicine exams. If you don't know something, it's absolutely okay. You're allowed to fail questions, but don't dwell on it and don't let that knock your confidence and impact the rest of your technique and the rest of your exam performance. And don't overthink. You have like very little time. You just have to use your gut instinct. And if you've practiced a lot, you will just get good at recognizing the answers that it should be. You know, you'll see where they're trying to come from. It's a bit like with any of your subjects that you'll do, any of your A-level or GCSE subjects that you've done or will be doing. If you read the mark schemes, you see what they're wanting to get from you. So the more you practice, the more you'll understand exactly what they're expecting you to say. And then you just play the game, really. You just have to, even if you don't understand what's going on, just say, I know this is what they will be expecting me to answer. So if you are taking the UCAT, as we've said, take it anytime over the summer. Sorry, I'm just reading the chat because someone raised their hand. So taking the UCAT over the summer, as we've already said, it's up to you whether you take it early or later. Different people prefer different things. Some people want to get UCAT out of the way and write their personal statement after and do work experience. I did mine very early because I wanted to get it over and done with. Some people prefer later because that gives them more time to actually practice the UCAT questions, etc. It's completely up to you. It doesn't matter. It won't affect your score. It won't affect how the university looks at you. The only sort of, I guess, positive of taking it later is as people take the UCAT, the scores get published. So you can see, I think usually they release one sort of halfway through where they say, you know, the top 10% of people currently are scoring about, you know, X, Y, Z. So if you take it early, you don't exactly know where you've placed compared to the rest of your cohort. Whereas if you like later take it later, then you get your score back and you already know roughly where you're lying within, you know, which decile you lie in. So, yeah, but it's up to you. You don't have to choose one or the other. It doesn't matter. But if you plan on doing the BMAT, most people will take the UCAT very early and then they will then revise for the BMAT after they've taken the UCAT. So just focus one at a time, which I think is quite a sensible move. Usually, if you are looking at those average deciles, the one that comes first usually is higher than what the actual average scores will be, because people who take the BMAT are often aiming for the Oxford, Cambridge sort of universities, so they tend to be very clever, so they tend to do slightly better than people who take it later, just because of the types of people that they are. So you can expect the averages and the deciles to fall by the end of everyone taking it. So if you've not taken yours yet and then you look at the average and you're like, oh goodness me, then don't worry too much because it usually does fall. Useful resources, obviously SIXMed has UCAT resources. You do have to pay for them, but they are, you know, a big question bank and good for those early practicing your question techniques. The UCAT website is amazing. It's really good. I recommend you looking at it. It's got tips, it's got all the information you need about applying for UCAT, and they have question banks and practice questions, and both are set out like the real UCAT exam. So they even have the calculator, the flags, everything, so that you can actually practice what it's going to be like. They don't have many questions, which is the big issue. So what I always tell people to do is use other resources, and then in your last couple of weeks coming up to your exams, go to the UCAT website and take those mock papers, use the question banks, make sure you've got good Wi-Fi, and then just sit there and do the exams if you're actually taking your UCAT. That's the best thing to do, because those questions are amazing and exactly like what you're going to get. Hopefully you are a little bit more confident, or at least, you know, I understand this webinar isn't going to I've given you all the information and give you everything ready to go straight into taking the UCAT and getting 100%. But hopefully now you understand what type of questions are going to come up, and you'll feel a little bit more prepared about going into revision for your UCAT. It's sort of a starting block, and then you go and revise, and then hopefully by the time you take the UCAT, you will be a little bit more confident. We'll do questions now. I know some people asked about going back and talking about the questions that were before. I'm just going to start in the Q&A box, and then I will move over to the chat. People can leave if they want to. I'm just going to put a feedback form in the chat if that's okay. If you can fill it in if you get a chance, I would massively appreciate that. It's just for, I'm just trying to copy it. It's just for 6 Med, just so that they can get a bit of feedback on what works well, what doesn't, you know, on these sessions. So I just put that in the chat, and if you can fill it in, that would be appreciated. Sorry. Okay. I'll stop sharing just so I can see the chat better. But you feel free to leave it if you don't have any questions and don't want to sit and listen to the answers. So someone said, is there any point of doing UCAT if you did bad in your mocks? Mocks don't mean a lot, to be honest. Everyone does better in their real exams than they did in the mocks. I think especially with you guys who have been schooling through COVID, don't be too hard on yourself if you didn't do well on your mocks. If you think you're going to still want to apply for medicine, then you obviously do need to take the UCAT. I would say just don't get hung up on your mocks at all. Still, you know, apply, because you can still apply the year after. So I would say, yeah, there is still a point of doing it, but the only thing to think about is you do obviously have to pay to take the exam. So, you know, if you don't want to pay twice, then maybe think about taking a year out and resitting exams if you think that is the route that, you know, if you think that's what's going to happen, you're going to do badly in your actual A levels. But I would say, you know, 9 times out of 10 people do a lot better in their exams than they expect. So they still do it if you're thinking you want to apply now and you're thinking medicine. Yeah, if anyone is struggling to cover the cost of UCAT and BMAT, there are bursaries out there. I don't know much about them, but you can apply for bursaries to help with the cost because it is expensive. Can you explain the clearing process and how it would work if doing any offers with SAT that UCAT BMAT that you requires? So clearing happens the day of A-level results day, and medical schools do go into clearing, although at the moment I'm not sure how many will this year. Maybe next year they will, just because there's been a backlog of, after COVID, there's been a backlog of places, applicants to places. But usually what you do is you get your A-level results, you find out that you've not got into the medical school, and then you ring up the university admissions teams and ask if they have any places free. And if they do, they will offer you a place. And then if they don't, they'll just tell you that they don't have any free. And then usually, you don't have to go to interview for that. But it's quite difficult to go through clearing to get into medicine. I do know someone who's done it, but it was a very long time ago. I think she was like 3 or 4 years older than me. So it's quite rare that clearing actually happens. Just if you're thinking you might need to go through clearing, then have the clearing numbers already written down. Just make sure you have your clearing numbers written down because it's first come, first serve. So you want to be quick straight after results have come out to ring them. That's all. That's it. Universities do get your results a couple of days before you do, so they will already know if they've got clearing places or not before A-level results day. So sometimes some of them will publish that they have places, and then you can go off that. But the process is really to just ring up the admissions team and ask if they have any places free. Courses like biology, biomed, they very often go into clearing. So if you're still wanting to go to university but not thinking medicine, then consider clearing with them. How do you write for UCAT, such as website books? I personally used a book. I got it through my school because an older student who'd had applied to medicine had bought this book, and then it was just being passed down through the school. And so I just borrowed it. And then it was called something like 1,500 questions for UCAT or something. They all called something along those lines. They're also all sold on the internet secondhand for very cheap. So I got one of those, and just for 15 minutes a day for a couple of months before my UCAT, just did a couple of questions just to get a feel for what where my weaknesses were, where my strengths were, and the technique, etc. And then I used the UCAT website nearer the time. That's how I worked. There were loads of question banks. It doesn't matter which question bank you use, whether you use a book, whether you use a website, whether you use, six meds or any others that you found. They'll all do the same thing, but it's just practicing your technique and then practicing timed nearer the time. How do you go about revising close to exams, just day or days before? I wouldn't revise the day before your UCAT, or don't revise a lot. Make sure you go to sleep early, make sure you eat and drink enough before the exam. It's hard, you can't cram UCAT because of it's skill-based, it's not so much knowledge-based. So do some questions to get into the mood of doing it, but don't be cramming, don't spend the whole day doing revision. Just do a little bit to get ready, get in the mindset, but make sure you are as relaxed as you can be, because so much of it is how you perform under the stress, so make sure you're not overly stressed. Did you use any tips and tricks in the UCAT to help you under time conditions, such as keys to switch to the next question? I don't think I did, actually. I'm trying to think. I don't think I personally did. I don't know any actual tips or tricks, but like I said, I was never computer savvy. So I personally didn't use a whiteboard. I didn't write down anything. I did as much as I could in my head, just because, taking the pen lid off and all that, it just wastes seconds. And in a UCAT, when you've only got a couple of seconds to each question, it does. Saving seconds can mean that you do an extra question. But I don't think I ever specifically used any tips or tricks in terms of like computer keys or anything. In terms of time conditions, you just have to practice and just have to learn when to say, I have no clue what's going on in this question, I'm just going to move on and choose a random answer. The beauty with MCQ is you do still have a chance of getting the answer right, even if you just take a complete stab in the dark. Any point if your predicted grades are lower. If you're applying to a university which doesn't look at your predicted grades, then it's fine. Take the UCAT if you are thinking of applying to medicine. If you're still in the mindset of I want to apply to medicine this year, and my application is probably strong enough to get into a medical school, then yeah, you need to take the exams. If you look at your predicted grades and you're thinking there's no chance any medical school's going to take me, think about taking a year out and improving on those and taking the UCAT the year after. If you have enough money to do it, and then even if you're thinking of applying the year after because you're going to have to work on your grades, then feel free to. I don't like sitting here saying just take it, why not, when you have to pay to do it. So it's kind of you'll have to look at your application as a whole and find some universities that you think might take your application, and then make the judgment off that. Someone said we'll be able to download these slides. I'm not sure if you can download the slides, but you definitely can get recordings of the webinars. So I would have thought you'd either be able to download the slides or get the recording of the webinar, and then you should be able to see the slides again. How long do you recommend revising for the UCAT and how much every day? So like I said, I just revise for 10 to 15 minutes every day for a very long time, for a couple of months. That's what worked for me, because you just want to do little and often. So like it would be an afternoon when I'd finish doing whatever I was doing for the day, and I'd be like, oh, I'll just do a couple of questions. That's how you revise in medicine as well. So it's a nice thing to get used to, because obviously when you get into your later years of medicine, there's so much content that you can't actually sit and revise like you will have done for your A-levels and GCSEs. You have to do practice questions little and often. So I would say, even if you've got an app on your phone or something that has a question bank on it, just maybe if you're sitting on public transport or in a car, or you're waiting for someone, then you can just take out and say, well, I'll do 5 minutes now while I'm not doing anything else, and just doing little and often. Some people would rather, do it in big chunks, but I don't find that as effective personally. So I just recommend the little and often. Do you have any advice for someone who attempted resitting the UCAT after doing badly last year? So don't get caught up on the fact that you did badly last year is the number one piece of advice that I have. People fail exams, medical students fail exams all the time. We can't be perfect, and the UCAT is hard and medicine is hard. And so don't get hung up on the fact that you did badly, so you will do badly next time. That's not at all the case. Just think about, was there one question type where you were slightly weaker? Was there any that you were stronger at? And make sure that you really focus on all the areas, but specifically those areas of weakness. And just when you go in, just try and, I don't know what the word is, but try not to get hung up on the fact that you did badly last year, because that will affect your performance. So yeah, I would just say you're in a good space because you've done it before. You know what it feels like being in that room and what the questions are like. And yeah, just revise and you should be okay. Can you go for clearing if you didn't apply for that uni or didn't get an offer? Yeah, you can. You can apply to any university through clearing. Even if you didn't apply for that uni, didn't get an offer, that's fine. They don't look at that. I don't know if some have preferential treatment for people they gave an offer to, or people who accepted an offer but got lower grades in their A-levels. But so I think some do, but you don't have to have gone through that. You don't have to have applied to that uni. Will the recording be sent to us? I'm not sure how it works. I think you might have to request it, but I'm not sure. I'm sorry. But I know that you can get it. I know I've been told before that you should be able to access it. Okay, right. I'm going to go through the chat. Feel free to put more in the Q&A, that's fine. I'll come back to it, but I'll just do the chat questions first. Okay, any strategies for doing decision-making questions and abstract reasoning other than SSPN? I don't know what SSPN means, but I would say it's difficult because there are strategies out there. If you go online, you will find people who've developed strategies to do them. As you know, with everything, there's always people who are trying to develop a way of making it easier for you. The problem is that timekeeping makes it really hard to actually apply any techniques other than really practicing a lot and then getting used to the questions to the point where you kind of just know the answers. So it's a tricky one. Like I said, with abstract reasoning, people have come up with lists of the common patterns, although you can then get hung up on trying to force the pattern to be one of those common patterns when it isn't always. So that can be, you know, apart from the fact that it's hard to implicate, it's hard to, that's not the right word. Apart from the fact that in the time it's hard to use that strategy, it can actually have a negative impact on you. So I would say probably just don't get too hung up on strategies, just go through the questions, go through a question bank and you know, try and figure out if you have any strategies, I suppose, and just look at what they are looking for. Even if you're doing really bad and you're really struggling with all the questions, even if you look at the answers to a few, just so you can see what exactly they're asking you to do. But there's no sort of techniques I can actually recommend, which I apologize for. Start my A-levels this summer, but I am taking UCAT this September. But can I retake A-levels in August and apply that year with the UCAT that I'm taking now? So just your application needs to be a couple of months after you've taken the UCAT. That's the only thing that matters. So if your UCAS application is within the same year as taking your UCAT, not academic year, actual year, then you'll be fine. But if it just basically, your UCAT needs to come just a couple of months before your UCAS application. That's just what the rule is. Grad medicine is different. It's a different exam. I can't remember what it's called. I always forget what it's called. The GAMSAT, that's what it's called. It's very similar, but it's a different exam. I'm pretty sure the questions are similar. It's slightly harder. But if you're a grad student applying for undergrad medicine, then you need to take the undergrad application. It doesn't, just because you're a grad student doesn't mean you take the GAMSAT if your medical course is undergrad still, because you are allowed to apply to undergrad if you are a grad. Okay, so someone asked a question about the verbal reasoning question, asking why wasn't it can't tell if it doesn't explicitly say, because you can tell. It really is the, I'm trying to find the question. So I'm just finding the question and I can actually tell you. So the passage says, companies that run these internships often take several students at a time and may end up offering them permanent full-time work at the end of summer. And then the question says, university students need to undertake a summer internship in order to be offered a full-time job. So it never says within the passage that, it never applies that you have to take the internship. So then it's obviously not true, which I think everyone kind of understands. And then it says that they may end up offering them full-time work. It's really hard to explain. I'm sorry, I'm just trying to think of a nice clear way of explaining it to you. Okay, and then earlier in the passage, it also says experiences that the students have can be beneficial to talk about at future job interviews. And then they may be offered jobs. I'm sorry, it's really hard to explain. I don't know if anyone else who did the question earlier is going to be better at explaining than I am, because I'm struggling a little bit. It's a really tricky one. It's really hard. The more questions you do, the more you can see whether it's going to be a can't tell or a false. So when I read it, I know that it's going to be a false, but it's really hard to put that into words and explain it to you. So I'm trying to, because I don't want to just ignore your question. I'm sorry, I will come back to it if I can think of a way of explaining it to you. I don't want to sort of make it more complicated. I'll answer everyone else's questions and I'll come back to this question because it's throwing me a little bit. How do you answer questions like there is a donor for a kidney, 2 people, old and young, are perfect. Who do you give it to? I don't know whether you mean like in an interview setting or whether it would come up in a situational judgment test. You just have to like weigh up the pros and cons of each. Usually it's like a justice question if you've ever done any reading on the 4 pillars of medical ethics. It's like a question that's based on justice mainly. And you have to think of the impact to them. Do they have families? What is the impact on the families? What's the impact on society? So for example, if the old person was someone in their 50s or 60s who was a doctor, are they more beneficial to society than a young person who, I don't know, had a different job that was, you know, like an influencer or something? So you have to just weigh up all the pros and cons for each. If it's an interview, you do have to weigh up the pros and cons for each and then make a decision. I don't think it would really come up in a situational judgment test because they focus more on professionalism more than like this kind of ethics. So it would be more like a colleague comes in drunk and you do this. Well, is that appropriate? It's usually a bit more subtle, but yeah, you just have to weigh up the pros and cons, think of the 4 pillars of medical ethics, and then make a decision, I guess. 9 times out of 10 it's the young person who gets it in these questions. Would you recommend buying a book to keep notes for any particularly difficult AR patterns, useful tips for UCAT? If you want to, I think everyone's slightly different. Everyone has different revision techniques. If you do want to, you know, go through and pick up on what the patterns are and like look at it, and you think that'd be helpful for you, go for it. I would say do the questions in the same notebook or keep the paper together so you can flip back and look through your past questions. I think that's always useful, going back and doing questions you've already done before. I'm a big advocate for that because with the UCAT, and same when you come to medical school and you do your big MCQ exams, they use question banks. So they do reuse questions. So, you know, I think, yeah, keep going through them. But yeah, I would keep just notes together. And if you are going through doing the questions, you think, oh, this technique's really working for me, then yeah, you know, make a note of that and do it. Someone's taking it in 3 days, good luck. How much time do you reckon spend for UCAT prep? Again, like I said, little and often. I took a couple of months, but did it in a very small amount. Maybe if you do more, you don't need to, start as early as I did, if you want to do more in a day. But again, it's what works for you. Maybe you're the kind of person who knows that you will get really sad and stressed out if you're having to do a bit of revision every day, and you'd prefer to dedicate, 1 day a week to doing it. You just have to do what works for you, but I would recommend a little often. Someone said use PassMed. PassMed's good. Someone said med entry is good for questions. Someone said, which question bank did you use? Like I said, I used that book. The books are good. The cheaper books will be called UCAT. They're still the same questions. But, don't be afraid to use an old book. It'll be cheaper. Most of them you can get for a couple of pounds. I've seen Manchester and Imperial Med in UCAS Extra this year, but I think they're mainly taking people who got rejected post-interview. I don't know much about that, but yeah, I do think sometimes they do, if you put someone as your firm offer, your firm choice, and then you don't make the grades, I think they do consider those individuals first, and then then move down to people who interviewed there to then people who didn't. There aren't ever that many places in Cleary. Is it worth doing biomed first if your grades aren't good enough and don't get any medical offers to get straight from sixth form, as most unis don't accept resets? Well, yeah, it is. Some universities do a transfer scheme where if you go and do biomed and you do really well and you're in the top 3% of people, you can switch over to medicine if you want, because usually first year medicine isn't that different to a biomed degree. I can't remember which universities offer it. I know Manchester doesn't anymore, but they used to. So that's one option. Then you can do either grad med or undergrad med following a degree. Grad med is hard to get into. It's very competitive because it's a slightly shorter course, and it's quite a lot of work when you get onto it. But you can do undergrad med. If you're a grad student and then you apply to do undergrad med, it's usually a little easier to get in. If you don't have the grades and the university you want to go to doesn't accept resets, if you take a degree and do well in your degree, they don't look at your A-level. So it is absolutely an option. Also, there's things like now they're called physician's associates, and there are other ones that are similar to that, where you can do a different degree. You don't become a doctor, but after taking a biomed degree, you do another 2 years and you can become a physician's associate, and they do a very similar job to a doctor, but they're just not a doctor. They usually don't have prescribing rights, and they're slightly less senior. They usually work underneath a doctor, but if you're interested in actually doing the work of a doctor, and that's another option you can do, and then you don't have to do 8 or 9 years of university. But it is worth it because they will look at your degree and not your A-levels. So yeah. Yes, so someone just about the verbal reasoning question said, I think you put can't tell as an option if there's no information in the passage. But if there is relevant information that would imply the question, then you put false. That is right. That's sort of where I was trying to go with it, but it's hard to explain. Because in the passage it consistently said things like, if you do an internship, you might get offered a job with a company. It wasn't saying people do the internships to get because it's the only way to get a job. It was saying that only some people who actually do the internships get offered a job. So it was implying that you didn't have to. But yeah, I think whereas if it had said something more along the lines of people do these internships and then it like later on in the passage said some people get jobs and it wasn't really linked, then it would be more can't tell because there's no implication there. But it's really hard to explain. It is, if you do more questions, you understand it a little better. One other thing with the verbal reasoning that I forgot to mention earlier is if you have prior knowledge on whatever the passage is, try and forget it, because they're always on something really strange, like they might be on penguins or something. If you know a lot about penguins and it asks you, is this true, false, or can't tell, and you know that it's a true fact, but it nowhere in the passage says that, then answer it in the same way you would answer another question. Like, try and forget any prior knowledge, it doesn't count. In the SGT, I just can't recognize if it's very inappropriate or just inappropriate. Do you have any tips on how to solve this problem? So very inappropriate is more common than just inappropriate as like an answer. So if you're really stuck, I would choose very inappropriate. In terms of things that are like inappropriate but not awful, I'm trying to think of a good example. It's more, there are just some rules of medicine that they're things you don't do. So you don't undermine a colleague, you don't affect that patient-doctor relationship, you don't put a patient at risk. So all of those things would be very inappropriate. If it was asking you, if it was saying something along the lines of like, I'm trying to think of an example, there'd usually be something like where you had to prioritize tasks. So I'm trying to think of one. It would be something along the lines of, I'm sorry, I'm just trying to think of a question because it's the easiest way of explaining it. But it would be something like you delay action. So something bad was happening to a patient and then you delayed action, but you still were going to report whatever had happened. That's not super inappropriate because you are still doing something right, but you haven't prevented the situation. You haven't sorted it in the moment. So the ones that are inappropriate but not awful are along the lines of the fact that you've done something that is good, but there still has been some damage done, so you haven't acted quick enough is usually the one that comes up the most. There are always ones that are like, you see something on the ward and then you have a meeting, so you don't know whether to go to the meeting or sort out the thing in the ward, and then if you go to the meeting but then later report the incident, that would be like an inappropriate but not awful situation. They're usually along those lines where you've done the right thing but you've not done it quick enough. So that's usually what it is. I don't think I've got any more questions in the chat. Feel free to put some more in if you want to. I apologize if this, hopefully it was at least a little bit helpful. Hopefully it's given you a little bit of a a background so that you can actually go and revise and do well. I do just apologize if my explanations have been a bit funny today. How do you determine something is not important at all? So, well, let me think of I'm actually just going to Google SGT questions. See if I can find one as an example. Okay, I can't find one quick enough. So not important at all. They're questions that are along the lines of they'll have a situation and it'll say how important are these factors in like just making your decision, and then the factors it'll give you a couple of factors, and the factors will be something like patient safety, that one's always important, and then there'll be one usually that's like your progression in your course or progression in your job, will you get a promotion or something, and usually those ones are like not important at all, or like getting home on time, and you're like, those are usually the not important at all kind of answers. So the question will say, this has happened, you're trying to come up with what you should do, which is like, how important are these factors, and then it would be something that isn't an important factor, and it would say something like, the fact you're friends with the person who was drunk at work or something, and you would say that's not important at all. I would say the importance ones are a little easier than the appropriateness ones. What's your best advice for verbal? Just practice like scan reading, and I, to be fair, didn't do as well in my verbal as I did in my other sections, so it is hard, and just try not to get stressed out, try not to beat yourself up if you don't finish the questions. Yeah, scan reading is just important, and then just be confident with your decisions, I guess. Just if you feel like one's the answer, just go for it and then move on and just get as many questions as you can done. But yeah, just reading quickly is just as much time as you can give yourself to actually think about the question is the best thing to do. Okay, someone said this Zoom was helpful. Good. I feel like I've been a bit all over the place today, so I apologize if I have, if any of you didn't find it useful, but I'm glad it was helpful for at least one person. Any tips for prepping for BMAT section 1? So I never sat the BMAT, so I don't usually like talking about it myself, because I think the advice you get is so much better for someone who actually sat the BMAT. But BMAT is a bit easier to revise for than UCAT, because they tell you more about what kind of thing they're looking for. They have specs and stuff, so I would say go through specs and see what kind of answers they actually want. I can't remember, BMAT section 1, is that the like thinking problem solving skills one? Yeah, it is. Like with anything, it'll be practice questions as much as you can and go through mark schemes and see what exactly they are actually looking for. And yeah, so I apologize, I'm not so good on that. I know there are some BMAT webinars coming up where they go into BMAT in a lot of detail. There are some more UCAT ones coming up where they go into UCAT in like a lot of detail, where each section is given its own hour or so. So if you're still stuck, go to those webinars, and you should be they should be able to explain in a lot more detail and give you example questions, etc. So I apologize, I don't know much about BMAT. I never teach it just because I didn't take it. So I do like giving tips, because if you have any more questions, feel free to put them in the chat. If not, you can feel free to leave. Thank you for asking questions. Hopefully it was useful, and good luck everyone with your whole application. Thanks, that's okay. Good luck with everything. Thank you for coming. Good luck. I hope it all goes well. It's okay. We'll just give it one more minute, just in case any of you are typing, and then I'll end the chat, but feel free to leave if you want to. If you've got any questions, just quickly pop a message in the chat. Okay, guys, I'm gonna end the call now. So hopefully it was useful for you guys. Thank you. Good luck, everyone. Bye bye.